Hi, my name is Representative My-Linh Thai. I have the honor to represent the 41st Legislative District. And with me today is my dear friend, Representative Nicole Macri, who is the representative for the 43rd Legislative District. I invite my friend here to have a conversation regarding Washington Cares Fund. Um, this triggers because there's so much questions and misinformations out there. And first and foremost, I just wanted to state that the reason why we working on this, and this was in 2019, when I first come to Olympia and joined the legislature, I was so happy to vote yes for this legislation because we know Washingtonian does not have coverage for long-term care, and many Washingtonians suffer because of that. Since that legislation, and there's a lot have happened. So, Representative Macri, would you like to share what happened and what's your role as a member of the commission?
Thanks so much, Representative Thai. It's really great to be here. And like you, I've heard a lot from constituents who've been confused about what is the purpose of this program and how it's going to impact them and their families. You know, like you, I was really proud to vote for this policy back in 2019 because we need to help our seniors stay in their homes, and we need to help Washington families avoid bankruptcy. And for too many people, that's the reality when they face escalating needs, like they need help taking care of themselves, going shopping, cooking, etc. And we have this opportunity to provide support for folks. As you said, I have been serving on the Long-Term Services and Supports Trust Commission, which is a mouthful, but essentially it is the advisory group that is helping to stand up the new Washington Cares program. And we've been really looking at a number of different issues to make sure this program launches well and meets that objective that I talked about, really making sure that seniors in Washington State can maintain their independence and avoid bankruptcy. Right now, we have a system where people need to spend their way into poverty by covering their long-term needs until they have nothing. They lose their homes, they lose their possessions, and when they are impoverished, can then qualify for Medicaid low-income health insurance to get their long-term care needs. And that's just an inhumane, inefficient, harmful way for people to get their basic needs met. This issue is really personal for me. I have gone through this experience with several family members of mine, most recently with my partner's dad, who needed a lot of care in his final years. And I know the hardship. It's not just the hardship on folks going through the need for long-term care, but for all of us. I've had to take time off of work. My partner had to actually cut her hours at work for many years to provide support for her dad. And that can be incredible hardship on families. It certainly was on ours.
I'm sure that your stories is resounding across our state. It's not simply an urban or rural. It's not simply about middle income, low income individual in our state, but certainly in many families. But as we stated, Nicole, there's so much confusions out there. At the same time, we as legislator also recognizes that the policy we passed in 2019 left a few group of communities out of the policy itself as far as coverage. Could you share at least those that the community that we identified as not being covered under these policies, and how is that in the conversation within the commission that you are serving?
We have definitely identified the need for some reforms. This is a really bold policy that addresses a challenge that too many families in Washington face. and a solution that we need to implement quickly, but we need to do it well, and we need to ensure fairness. So we have been looking at reforms as we've been working towards the implementation of the program. There are a number of people across the state who will not benefit from this program in the way we intend if we don't make some changes to it. So we'll see a handful of policy bills early in the 2022 legislative session that will address some of the reforms that we need to make for folks. So for instance, Washington State is fortunate to have a number of military installations, and for spouses of military members who relocate to Washington State bases for a short amount of time, usually a handful of years, they will be unlikely to vest in this program because of the brevity of their work here. So it makes sense to provide an opportunity for folks to opt out of the program. Similarly, we are a state that welcomes a lot of immigrant workers, both in our agricultural work as well as in a lot of our high-tech work. So we have workers coming from all around the world who are here for a short number of years, again, who are unlikely to vest in the program, and for whom we want to make sure there are some options to opt out of the program. The issue that I hear a lot from my neighbors are folks who are thinking about retiring before the 10-year vesting period. This is a program that's designed for people, for everyone to pay a little in to the program through payroll deduction during their working years, and then be eligible for a safety net benefit that will keep people independent in their homes for as long as possible. But for folks who pay in but don't reach that 10-year vesting period that is designed in the program, we need to come up with a different option. So we're looking at options for folks, including an option to ensure a prorated benefit. That's something that many of us who are accustomed to workplace benefits are used to, that if you don't reach the full 10-year vesting period, you're still able to draw down a portion of the benefit. So that's an option that we're looking at as well. And then we're hearing from employers around the state, particularly around the Idaho border, around the Oregon border, that we have employees who live out of state, who work in Washington, who are unlikely to be eligible for services here within Washington state. And so we're looking at options for those out of state, border state workers in British Columbia, Idaho, and Oregon. So those are just a handful of the reforms that we're looking at that we hope to have lively conversation about, because what we're mostly focused on, as I said, was making sure we can protect seniors, protect them from bankruptcy, protecting them from having to get a high level of care when a low level of support, somebody needs a wheelchair ramp built to their house, or they need help with their laundry or help with their grocery shopping, that they can get that kind of support. And for many people, that will help them avoid losing their independence and needing to go into more formal care like skilled nursing homes. And so we know this is a program that's needed, and we know that with reforms, it's something that we can really make work. I'm really proud that Washington is the first state to really take this important step. This is a problem nationwide, and I've been talking to people from other states who are really looking to us to see how we are addressing this challenge. And I'm really grateful to you. I know you have been talking with a lot of folks in your district about this, and your input on some of these reforms has been really, really helpful to the considerations we're making. So thanks for talking some about this program and how we can make it work for everyone.
Well, thank you, Representative Macri, for such an informative, although in a very short period of time, for something as complicated and lot of nuance. Certainly, we have more work to do. It's really reminds me of several of the programs that's already in existence that is really helpful for many. In Washington State, we have the program that would help with paid family leave. And now it's running. We know that it impacts people's lives in a positive way. Two others at the national level, our Medicare program and our Social Security program. These two really showcase that when we come together and we all contribute to a long-term, big picture support, all of us benefit. And I would like to also invite the public to engage and follow the work of the commission. This is a public commission, and you are invited to check out their webpage to find out when their meetings are and attend them so that we can all learn together. As always, we hope that you continue to reach out to both Representative Macri and myself to share with us your concerns and support. We're here for you. We are the People First Legislature. Thank you.